Happy Monday. Hi. What's up? Monday. Hi. I have my lunch. Here we are for a Monday, you know, kind of hang out, check in sesh while we eat together. Aw, I'm so glad you're here. This is fun today, probably because I'm making it. I think it's going to be easy for a lot of people who maybe don't get to come every week because of like school or work. A lot of people are off for the holidays, so I'm hoping to catch some friends that haven't been able to join us in a while. How is your world? We're just hanging out this week. It's an easy week for me. It usually isn't. Like, Thanksgiving is not a holiday I usually love, but I'm looking forward to this week. Hi, chronically coloring. You're not super pumped either, Elizabeth. Yeah. I mean, I'm hearing that from so many people. Not looking forward to this holiday. I think this holiday is mixed, right? Because last year we know the shit show that was last year and the holidays last year. So there's kind of this, there is this hope, right? And kind of excitement and being able to maybe go see people, see family who you weren't able to see last year. I have a friend who she lives here and her partner is from England and his family hasn't been able to come over. And yes, we are talking Thanksgiving. And they like got married, they had a baby during all of that time and they weren't able to come. So here we are now, people can travel and visit. So there's a lot of excitement around that. But I also understand why you don't feel excited for the holiday, for the day. There are many, many, many reasons for that. Family, right, is probably like the first of many issues, but it's also a big food holiday. And then all of this like diet culture, weight loss, messaging stuff is out there. And so it feels really hard to try to maybe enjoy a holiday around food. So it can feel like a lot. You're also in Sherman? Hey, that's awesome. Yeah, Sherman, Texas. That's amazing. Small world. Maybe not. The world isn't so small. Right, not being in your space during the holiday, like if you have to like travel somewhere. I work with a lot of, excuse me. I work with a lot of college students in my practice. And what I get so mad about are they come through on like Friday at noon or whatever, and they're like, all right, you got to move out of college housing. Like, that's so messed up because some people don't have functional or healthy families that they want to go to. Some maybe were homeless and like that's their only home. Also, that's like your space. So I just hate that college students are kicked out of their dorms or their places. But if you're traveling to go see grandparents, aunts, uncles, parents. It's a lot. It's hard. Right? And then there's this issue of people who may not be able to be vaccinated for whatever reason. It's still weird to gather. It's still like not like it used to be, certainly. And it is, this holiday still doesn't feel like normal, right? So if you hated or disliked the holiday prior to the pandemic, great. Your attitude about it probably hasn't changed. You probably still dislike the holiday. And then with all this like extra added pressure and stuff going on this year, I can see why many people aren't looking forward to it. I am not having to do anything for the holiday. Like literally, I just have to show up. I am privileged to have a local family in the area, so like we don't have to travel very far. So it is going to be easy for me to just show up and enjoy people. Random question. How do you deal with being weighed? So I don't weigh my clients. I have a scale in my office, and I have weighed clients on like a couple of occasions because sometimes rural Texas doesn't have access to all the providers locally, and I'm in a real small rural area. So a lot of times there's like a dietitian or a doctor somewhere. So I've weighed clients for them, and I'll explain, it's a blind weight. They don't see it, they turn around, and then we kind of like, I give them a moment, if they need to talk about it or want to talk about it, but I try to not make weight a big deal, honestly. Like it is what it is, right? And so I don't typically weigh people. So you could probably honestly just decline it, but there is sometimes, not often, when it's medically necessary to weigh somebody. But it's not, I'm outpatient, right? So an outpatient, people are really in their lives and they're functioning pretty highly. So usually that doesn't mean people are like malnourished or not having to do like the refeeding or the weight restoration piece at that stage. But usually, all I'm trying to say is that it is sometimes, not often, sometimes medically necessary to weigh somebody. But like that's when you talk to your doctor, your dietitian, and you kind of ask them if they can hide it from you. They should be hiding it from you, honestly, because you don't need to see your weight. Mm-hmm. Mm. Right, your doctor probably does require it. And I can again see the justification for that, but it doesn't necessarily mean that number means anything. You don't need to know what it is. They're gathering it. It's a data number. It's a data piece, a data set, right? That is just giving them information. That's it. It doesn't tell them anything about where you're at, how you're doing, your health. It's just a piece of information. Your psych should know not to show it, but honestly, they don't know not to show it. I can't tell you how many times I've had to call doctors, psychiatrists, or other treatment providers and say, hey, please keep the weight hidden from this person. They don't always know. Hi. Mm-hmm. Yes. So there are things like that that exist. So More Love Org on Instagram, there's cards, right? So you could even print out this card, put it in your pocket, put it in your wallet, And then when you go to the doctor, you can hand them this card, and it's essentially saying like, hey, I'm refusing to have my weight unless it's medically necessary. And if it is, I don't want to see it. Like, just get the information that you need, and then don't like repeat it to me. Don't tell me. Let's move on. I wish they did too. They don't need that information, but it's going to be a long time before that's taken out of assessments. I hope that one day it will. Dieting is kind of like smoking. So think about, so I was born in the 80s, and back then everybody smoked everywhere. You smoked in hospitals, airplanes. They used to tell pregnant women it was okay to smoke. And like doctors would give that advice, right? Well, now here we are on the other side of that and realizing how terrible that advice was. And I think that's where we're starting to get into with dieting, right? For so long, it was just like, everybody diets. It's what we do. It's what doctors tell people to do. Now we're getting into all the data and research and information about the harm of that and the inaccuracy of like sustainability of that, right? And so now we're looking at, so now we've got to undo all of that information, which is going to take some time. But there are cards. You can call your doctor if you have a therapist. If you have like somebody who gets eating disorders, they can make a phone call to the doctor for you, a parent. There aren't many resources in your area. I hear that a lot. That is very discouraging. It's one reason why I created the Recovery Academy. If you go to recovery-academy.com, I try to teach you everything I know about treating eating disorders, recovery from an eating disorder. It's information that I've learned from professional, personal, individual practice with people. I teach you all of that and share with you the resources and tools that I give to all my clients in those courses. So recovery-academy.com is where you can check out some of that. Is that therapy? No. Is that treatment? No. It's a support thing, and it's really discouraging when you live in a place and you don't have access to therapists and doctors. I hate hearing that. Great question. Let me chew this a bit. If you have an eating disorder, is it recommended that you see someone who specializes in eating disorders, or will any psychologist, therapist be helpful? Best practice, best thing is somebody who specializes in eating disorders. It is a very specialized disease. That takes, unfortunately, it takes extra training and like supervision and stuff to treat eating disorders. But I understand that's part of the problem. There aren't those folks available all the time. So a therapist is great to help you because it is a mental health issue. It is an emotional issue. So can you work with a therapist to find ways to manage anxiety, to work on, self-worth, self-care? Those sorts of things can help you need less of your eating disorder to care for you. Oh, my dog's here below me. TikTok can probably see him. He's begging for a morsel. But he makes it like he lays and you can't move. They say hi, Fenway. Mm. Hmm. I put up my Christmas tree over the weekend. That is a lot of work. It is a lot of work, but it's fun, and now I love that I get to enjoy it. Has anyone else put up their tree, or am I the only basic one? Mm. You do it slowly so your family won't complain. Yeah. I had to... Your tree just accidentally appeared. Oops, how did that happen, right? It was just like, we went to bed and then, ta-da! That's great. I had to slowly wear down my husband. Maybe it wasn't slowly, quickly, I don't know. But it was very much like, you have to wait until after Thanksgiving. That old debate, right? When is too early to put up your Christmas and all that stuff? Well, I just kind of was like, over the years, did it a little bit earlier and earlier and earlier. And truly, it is a chore. It's a lot of work. So now it's kind of like, listen, we're going to have to go to all the work to take it down, you know? So like, let's enjoy it for as long as we can. And so we've learned kind of, we do like a sweep. And as we do that, all the Christmas comes up, and then we'll do another winter sweep, and all of it will come down, and we move on. Hi, Christine. I have a comment, a question from Christine on Facebook. Do I treat a lot of BPD with eating disorders? Yeah. I don't want to say a lot. I have a lot of thoughts on BPD. It's a really stigmatized disorder that I think comes more from a place of like trauma. We want to make it sound like it's this like neurotic person, and certainly there are big emotions and big reactions when you are living with borderline personality disorder, but I often wonder like how much of it is really trauma, how much of it is really biologically experiencing really, 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 really big feelings and not having a great way to deal with them. So that's what I do in my practice. I just help people learn how to deal with their feelings in a healthy, appropriate way that works for them. You work at a vet clinic and people weigh themselves on the dog scale. There are people who want to weigh themselves all the time. It's really sad, like how we let that number try to define us or give us a piece of identity or give us some kind of like validation. It really is like this weird habit that we've created in each other, and it's a disordered behavior, especially if you're having to weigh yourself multiple times a day. Like, why? Like, you know what, you could maybe ask your boss if they can put like a note on it, like for dogs only or something. I don't know that you would keep everybody off, because there's just people like, when there's a will, there's a way, you know what I mean? But would some kind of sign deter it some? Maybe. You're really struggling, Chloe Kelly 49. Well, I'm glad you're here. And Chloe Kelly 49 on TikTok, having a hard time. And we're glad that you're here. And, you know, we'll sit here with you for a few minutes and eat our sandwiches. Recovery is hard, Christine, when you have this reaction. I hate to stigmatize BPD, so I'm trying to choose my words very clearly, because I think what happens, there is this wound, right? There is this deep loss of sense of self and loss of identity, I think, and that happens, and that's okay. It's not okay that you feel those things. You can like feel better, right? You can find your sense of self, but it really can cause very scary big feelings and really scary big reactions. And if you're trying to recover from an eating disorder, you have really big feelings and really big reactions, right? So the eating disorder, it's kind of all a big cycle. So it is a mental health and emotional health disorder, right? Sometimes you have to also learn how to deal with other mental health conditions. Love DBT. Very helpful. Good job, Christine. Proud of you for fighting and for showing up. And I have worked with people who have had bariatric surgery, so I'm familiar with the complications of it, how it can trigger disordered eating or eating disorders and can trigger all kinds of stuff. I want to invite you, Christine, to go to recovery-academy.com and check out some of the like different support and resources that are available there to you. You might find some of it helpful. You're Chloe Kelly, feeling horrible and feeling guilty. I can understand why you might feel that way. There are a lot of reasons why we feel shame and we struggle with accepting and liking ourselves. And I just want to say that I'm sorry that you feel that way, because you're not like designed or meant to feel those things. Like, you're not meant to feel horrible about yourself, and you're not meant to feel guilty about yourself. It's okay that you have those feelings. Those are normal human feelings. I've felt guilty. I've felt horrible about myself before. But know that you can move through that. You don't have to stay stuck in that place, and you're allowed to, get the support or take action, or, you're allowed to do whatever it takes to help you move through the hard stuff to get to a better place. You're allowed to be better and to want better. It's okay to be scared. Elizabeth, if you don't have safe things, could you take a safe thing? Like, maybe you can't have all your safety foods or utensils or items, but who said you can't have something? Like, is there something you can throw in a pocket? Something you can wear on you? Can you, use a utensil? Like, who cares if you pull a fork or utensils out of your pocket or your bag? Like, great. If that's something, if it will help you get through the meal with more ease to have an item that will make you feel safer, I'm all about safety. You're allowed to feel safe. Right, like a fidget thing, like a grounding stone or item, a comfortable. I love this sweater that I'm wearing because it just is so like, so like, could you wear like a comfortable clothing item or do whatever you need to do to feel safe at that meal? You don't have to be fully like challenged through it. You know what I mean? Like, you don't have to do all the hard things. Just do some of the hard things if you can. Kelsey, do you have a good TED Talk to recommend? I'd love to hear it. Brene Brown. Say no more. Yes, her TED Talk, Brene Brown's Listening to Shame, or if you have Netflix, you should be able to just search Brene Brown, and it's the same, like, I think, content of her TED Talk, but they give her a Netflix special. That's how great she is. To talk about shame and letting go of shame and guilt. Oh, it's so good. The Call to Courage, the book, The Gift of Imperfection, is really good. Like, all of her work is so good. Kristen Neff, thank you, Kristen, from Facebook. Kristen Neff's Self-Compassion, all of her work is really great too. Like, that's essentially the work that I do in my practice. Is I teach self-compassion. I teach how to let go of imperfection, how to let go of shame, because it's not about what you eat. Like, that's such a small, tiny piece of you and who you are and what you do. It's about living your life. So learn to, like, take care of yourself and love yourself and show up for yourself. And the eating doesn't get so hard when you do that. I'm sure you've seen all of their stuff in treatment. Yeah, it's just, that's how you treat this disease, right? All right, my friends. I'm going to hop off to finish my lunch and get back to my afternoon. Y'all are amazing. Y'all are strong. I'm so glad you were all here. You can get through Thursday. Follow my social media, recovery-academy.com, for lots of, like, support and things going on this week to help you. You're not alone. So y'all can do this, and I will be back on Monday, hopefully. So I'll see y'all Monday.